yell at my patients while we're doing treatment. I think it's funny because the device is solid state and it doesn't have it has an internal cooling. There's no like large cooling mechanism, so it airs itself out. So it's kind of level when we do the treatment. Yeah, you just wear that. Okay. Yeah, I think that'd be great. This is perfect. Okay. And the best part, no one asked. Is anyone going to ask me? Does she need to be numb? No, that's what I'm saying. No, she doesn't need to be numb. Even for hair removal, it doesn't even hurt. Barely. If you go to really high level, 8, 9, it can kind of start to hurt if you're really coarse hair. But for rejuvenation, rosacea, small vessels, acne, there's really no numbing response needed. And to be honest, if you're treating vessels, I really don't like to numb anyways. I'm kind of mean when it comes to that because it vasoconstricts. Yeah, that's fine. It vasoconstricts the vessel. So I just want to show you how easy it is. I want Cheryl to tell everybody, even if it hurts, you tell them it doesn't hurt. Okay? Okay. You're from New York, tell the truth. It's cute. I'm from LA and I still tell the truth. That's the problem.
I tell them like
you have no idea how much Vitrace I use. How much Vitrace do people use in their practice? I will tell you I use at least 5 boxes a month. That's 30 vials. At least. Sometimes more. Because all I do is reverse all day. Reverse, come back in 72 hours. Reverse, come back in 72 hours. Start with a clean canvas. I can't tell you this. I have no idea how to do it.
Okay.
So that's okay. Just lay back. As long as your head's back, you're not going to have any support. I need a goggle for myself, but everyone else is fine. Oh, the other thing is this laser will not affect cameras, or this device will not affect cameras. Now I just need the foot pedal. Bye, will you give me the foot pedal towards me, or someone bring that over here. So basically, this is for rejuvenation. So the goal for her is just to heat up the dermis. So you have to do multiple passes. You have to do it slowly. And then she'll tell us how it feels. So I'm going to start, okay? You guys are more than 2 feet? You're good. Okay. So I want you to tell me, how does it feel?
I don't feel anything.
She doesn't feel anything. So I thought when I started doing this doesn't do anything, this device. I go, we need to return this device. I told my staff, I was like, this device does nothing. You can't, So I was like, all right, I'll give it to 20 patients and we'll see. We started hair removal, we started rejuvenation. And over time, if you held it in place, so I'm going to hold it a little bit, you start to feel it? A little bit. Because it's building up the heat. And what you do is you do overlapping passes. And what will happen is the skin will turn a little red and it'll start to feel really warm because the dermis gets heated. At this level is rejuvenation. They're going to notice instant tightening, more of a glow. Deep dermal melasma will start to break apart and will work with all the epidermal treatments that you're doing that are trying to get through the epidermis when really now we're bypassing it into the dermis. If she had a lot of hair, like my Middle Eastern patients have on their face, they love this because it gets rid of the hair on their face. They don't have to get facial waxing. They don't have to get the facial, which is a real thing. They don't have to get the threading or electrolysis. So there's other things, like I said, acne, for example. This is really nice on back, on the face. Now, I'm only showing you the 4 millimeter full spot. There are other 2 and 3 millimeter spots that are focused. If you have a cyst, if you have a sunspot, an additional area, etc. How does it feel?
It's warm.
Just warm, so that's great. So we would do this with every treatment we did before we did it. So we do this before we do a fractionated non-ablative laser. We would do this before an ablative laser. We would do this before microneedling. This is our enhanced facial, etc. Almost like an IPL, but you're getting an IPL-like effect with almost no downtime in a series of treatments. That's the difference. The concentrated energy in IPL is epidermal. This is dermal, basically stimulation of your internal cells to remove treatment, to remove the medical condition. Okay? Perfect. So that's the device.
Don't stop.
I know. She wants a full treatment. She feels like she's at a spa right now. You're at the Westin Spa. So that's really the treatment. But again, now we're on speaker. in the office, I talk really loud, and the people think it's really funny. I'm like, you're not going to be able to hear me when we're doing this treatment. And then they think it's hilarious. So I was like, we're cleaning the office right now. We actually have a vacuum cleaner on. But you feel fine, and if you feel her forehead, it's super hot. Really, really hot. Do you feel it?
Yeah, it feels warm.
Yeah, it gets
like
really
I just
warm.
got out of a sauna.
So then again, if you do a facial, you have to go to your wedding that day, you do a treatment, you look great. And over time, it will decrease oil and help all that, and help even lift some of your pigmentation. So that's the Aerolase device. Do you guys have any questions about that for me?
How much for the machine?
You have to talk to them about it because they're doing different for you guys than the device. And I don't know, it's
They
changed.
give them a member discount.
You're gonna member discount. There's additional things you'll get with it. Plus, I got it a long time ago, so it's totally different in price. 5, you could do, like I said. I don't know how many indications total do you have. 40. 40? Jesus, excuse me. 40 indications. Does any laser have that? Not that I know of either.